Hi, welcome to the Cancer Detox, your wellness, your healing, your life. This is Dr. Janine Grace, PhD, scientist and cancer patient advocate at the Cancer Detox, where our number one goal is to significantly improve the survival outcomes of cancer patients, as well as educate everyone about the ability to prevent cancer, not just a new cancer, but also a recurring cancer. You can find more information about us at thecancerdetox.com. Let's talk about colon cancer prevention. Do fruits and vegetables help prevent colon cancer? And exactly how much do you need to eat? Well, the science is showing that yes, fruits and vegetables absolutely prevent colon cancer, and the numbers are actually quite impactful. A recent article from 2019 showed that there is a preventable cancer burden associated with a poor diet in the United States. This is out of Tufts University. And the authors started off with some interesting facts about cancer. They account for about 1 in 4 deaths in the United States. And it is estimated that in 2018, there were 1.7 million Americans who were diagnosed with cancer and about 600 million that actually died from it. What is the impact on our society? Well, in the US, there's about an $80 billion spend on direct medical costs due to cancer. And these factors, in addition to dietary and lifestyle factors, escalating healthcare costs, they really need to be addressed. And this is why we're here to present the facts and to help people make better choices when it comes to their diet and their lifestyle as it relates to cancer prevention. Because the science is showing poor dietary habits have long been recognized to be associated with cancer risk. Well, that actually flies in the face of a lot of pundits out there who suggest that it's all genetic. Not true. Obesity has been recognized as an important risk factor for 13 types of cancers. That's also a fact that really hasn't been well publicized. So now you know, and now you can start making better decisions. So where do we go from here? Well, the authors, they did a comparative risk assessment, and they wanted to look at dietary factors that the World Cancer Research Fund, as well as the American Institute for Cancer Research, have put out in terms of dietary factors that have either a convincing or probable evidence in terms of cancer risk. Well, for now, we can say it's been pretty convincing that fruits, vegetables, and whole grains have a favorable impact on cancer prevention. And processed meats, red meat, and sugar-sweetened beverages such as soda and fruit juices do not have a favorable impact as it relates to cancer prevention. What specifically is causing the problem? Well, they estimated that over 52,000 colon and rectal cancer cases were due to a poor diet. That's followed by cancers of the mouth, pharynx, and larynx, where more than 14,000 new cases were due to a poor diet, uterine cancer, more than 3,000 cases, and breast cancer in postmenopausal women, again, more than 3,000 cases were due to a poor or suboptimal diet. The largest number of cancer cases were colon and rectal cancer at about 38%. Now, looking at cancers of the mouth, pharynx, and larynx, almost 26%. What about cancers that we seem to hear a lot about, such as breast, pancreas, and prostate? Well, their numbers, their percentages were actually pretty low. Breast cancer, 1.5%, pancreatic cancer, 1.2%, and prostate cancer, 0.9%. So, what specifically do you need to be doing to improve your cancer prevention lifestyle? Well, you need to be eating more whole grains. And whole grains are important because of the fiber that's in them. Colon cancer had a very strong association with a diet that is lacking in a certain amount of whole grains. People who ate less than 125 grams per day of whole grains had an increased risk of colon and rectal cancer. As well, a low amount of total dairy products seems to increase the risk of colon and rectal cancer. Now, I do want to note here that the evidence is still out as dairy products have been implicated in other studies to cause cancer. Well, those studies were mainly cancers of the breast and the prostate, but still, as it relates to colon cancer, it seems to be important. Now, if you're going to eat dairy products, how about you start with dairy products that are fermented and include probiotics? That would be a good start. Diets that had more than 0 grams per day, well, they might as well have just said, do not eat any any processed meats. Diets that had more than 0 grams per day of processed meat was strongly associated with increased colon and rectal cancer. And again, processed meat includes bacon, hot dogs, sausages, and diets that were high in red meats, more than 14 grams per day, were strongly associated with increased colon and rectal cancer risk. So you want to be including more fruits and vegetables, more whole grains, and decreasing the amount of processed and red meats. The authors concluded the study by saying that we estimated more than 80,000 new cancer cases in 2015 were associated with a suboptimal intake of 7 dietary factors among US adults. Among the dietary factors evaluated, low consumption of whole grains and high intake of processed meats were associated with the largest number of new cancer cases. Suboptimal diet was associated with the most cases for colorectal cancer among all cancers, which makes sense considering the route that food takes in our bodies. Colon, rectal, mouth, pharynx, and larynx cancers were the highest that were associated with a suboptimal diet. How does this particular suboptimal diet compare when you look at other lifestyle factors? Well, alcohol intake seems to increase cancer risk by 4 to 6%. Being overweight or obese may increase cancer risk by 7 to 8%, and being physically inactive increases risk of cancer by 2 to 3%. This data seems to fall right in line with other data that's been presented specifically by Oyebode out of the UK. And the UK implemented a 5-a-day fruit and vegetable campaign that also was implemented by the US and subsequently dropped. However, we could all stand to be reminded that 5 a day is where we want to target. And I'll show you that and some compelling reasons as to why on the next slide. Well, what are our Australian colleagues doing? They're going for Go for 2+5 campaign. And I don't know if this is still in place, but it sounds good to me. 2 portions of fruit and 5 portions of vegetables a day to help prevent cancer. Now, this article by Oyebode not only looked at cancer prevention and specifically death from cancer, but also heart disease or cardiovascular disease. What did they find? Well, if you look at the middle column, And it shows that 3 to less than 5 servings of fruits and vegetables a day can lower your risk of cancer by 22%. What if you ate more? Well, 5 to less than 7 servings of fruits and vegetables a day can lower your risk of death from cancer by 29%. What about heart disease? And the evidence is quite clear. Again, 3 to less than 5 servings of fruits and vegetables a day lowers risk of death from heart disease by 22%, and 5 to less than 7 servings of vegetables a day lowers risk of death from heart disease by 26%. And if you go for the gusto and decide to eat 7 or more servings of fruits and vegetables a day, it appears you can significantly lower your risk of death from heart disease by about 37%. So why aren't we doing more of that? Well, I think that a lot of healthcare providers may not know some of this information. It could be hard to keep up with a lot of the scientific literature that comes out on this particular topic, but good news, the Cancer Detox, we are here. We make sure that we stay on top of the scientific literature and present it to you so that you can make great choices in your lifestyle. So go to our website. You'll see more information on colon cancer prevention in our recent articles. And don't forget that 80,000 cases of cancer can be prevented, as estimated by Zhang and colleagues, when you start improving your diet. So make sure you are eating lots of whole grains. Ditch the processed meat as more than 0 grams per day. That's right, 0 grams per day. So that means that you don't need to be eating any processed meat, which includes bacon and hot dogs, because it seems to increase the risk of cancer. Special populations need to beware because it appears that suboptimal diets may impact you more. African Americans, Hispanics, men in general, as well as middle-aged individuals seem to have the highest burden of cancer cases in this particular study. And suboptimal diets appear to impact these populations. So be very careful when you select what you put in your mouth. As I like to say, health over taste buds, and hey, stay informed. TheCancerDetox.com. Email us with any questions about this particular presentation or anything else about cancer prevention at hello@thecancerdetox.com. And you can find us on social media at The Cancer Detox. Happy cancer prevention, and thanks for tuning in. We'll talk to you next time.